the risk factors you can't control. What I say to people is if you have these risk factors that you cannot control, then we have to really do a good job on the ones you can control. So the ones that you can't, age. Really there's a biological and chronological age. So again, with lifestyle, I have people really focus on eating healthy, and as Linda was referring to, movement, being physically active. 2/3 of stroke occur in people over age 65, but they can occur at any age, as we've heard tonight. And it increases with age, doubles each decade after age 65. Now, what's interesting is men are more likely to actually have a stroke percentage-wise than women, but women are more likely to die from a stroke. Family history, if you have somebody in your family who's had heart disease or stroke, that does put you at risk. We generally say if it's a heart attack, we're looking at somebody over age 70. Ethnicity, so there's certain ethnic groups that actually have a higher incidence because they're more prone to having high blood pressure and diabetes. And if you yourself have a history of having had a previous stroke or a TIA, you're more prone to actually have a stroke again. So what's unique in women besides the superwoman complex? There's the role of estrogen. So a lot of people are hearing about this now and about hormones. Years ago, there was a study released called the WHO Initiative, and that's when you saw Premarin being pulled off the market, and that was basically a synthetic form of estrogen. And their study had showed that it increased risk of heart disease, and there's always been some worry surrounding cancers. With more research that's been done, they're actually looking at estrogen, certain types of estrogen, and if you look at bioidentical hormones, actually helping and being beneficial in women. Birth control pills can increase your risk, especially if you're over age 35 and if you smoke, and that's because it increases your clotting in the body. So menopause is another one, and that's because of the estrogen. Pregnancy we see because, again, your blood changes, your blood volume changes. You can get high blood pressure, gestational diabetes. So if we go to the next slide, menopause and cholesterol, this is where estrogen comes into play. When your estrogen goes down, HDL, which is your good cholesterol, helps protect the heart. It decreases as women age, and that's because of estrogen. So estrogen actually helps increase your HDL, as well as omega-3s, fish oils, and working out. LDL is the bad cholesterol, and we actually see it rise. It goes higher as women age. So no matter what you're doing lifestyle-wise, we see that rise. And so the decline of estrogen as women hit menopause is why we feel they match men then for risk as they hit menopause. There's also a tendency towards a higher blood pressure because of the lower estrogen, and women will start to create what they call their muffin top or their tire. A lot of that can actually come from cortisol as well, as they're getting more stressed, and cortisol will block estrogen.